As we continue through this great shutdown, brought on by this battle against the COVID-19 pandemic, it's important that we recognize the broader health risks that are being created. We're facing increased anxiety, increased uncertainty, and increased stress in our lives as our normal routines are disrupted. Some individuals are working much longer hours. Others are under pressure at work because many of their co-workers are now self-isolating or no longer willing to work. And then there are other individuals concerned about their own health, working in the front lines, in the healthcare system, as well as in grocery stores and other public-facing situations. Now, I'm not a health professional. I'm an economist. So why am I so concerned about these broader health issues? It's because our economy affects our health, and our health, in turn, affects our economy. For example, we know that Canadians with lower incomes experience poorer overall health than higher income Canadians. We also know that being unemployed has a negative impact on mental health, and almost 50,000 Atlantic Canadians lost their jobs in March of this year. And our health affects our economy. This goes beyond the economic costs and resources to treat sickness and disease, whether it's COVID-19 or some other situation. The economic cost and burden of mental health in Canada is estimated at over $50 billion per year, including direct healthcare costs as well as lost productivity. In a typical week, 500,000 employed Canadians are unable to work due to mental health problems. And individuals with a mental health illness are much less likely to be unemployed. And then we have the economic cost of substance abuse, which in Canada 5 years ago was estimated at almost $40 billion, led by alcohol and tobacco use, and then also opioid and cannabis use. So we need to recognize the importance of this issue. Only a relatively small proportion of our population will get sick with COVID-19. But we are all facing increased stress, increased anxiety, increased pressures due to this pandemic, and the measures that have been put in place to contain it, and the economic consequences of the Great Shutdown. So what can we do in this situation? Well, when we used to fly, we were reminded so often that we need to put our own oxygen mask on first. So we need to look after our own health. We need to look after our physical health. I can't wait to go back to the swimming pool. But until then, I've had to get my bike out, and I've had to go running. I'm not a runner, but I know I need cardiovascular exercise. And I don't want to come home and do exercises. I'd much rather go to the gym. But I know I need to. I know it's important for my physical health, especially when physical distancing from food and other treats in the kitchen are much harder. But more importantly, I know it's important for my mental health, because exercise is one of the strategies I use to help manage stress. So we need to look after our physical well-being. We also then need to look after our mental and emotional health. And it's been encouraging to see a number of organizations pay attention to this in this current pandemic. So we need to use healthy coping strategies, whether it's exercise, taking a break to do something relaxing, unplugging from the non-stop pandemic news. And I mention healthy coping strategies because the media reports seem to suggest people are also turning to unhealthy coping strategies in this pandemic. And for those with spiritual beliefs, drawing upon spiritual resources and spiritual practices can also be an important help. And then we have to look to our support networks. We are not supposed to be alone. We need to be with others. And being isolated is not healthy. So reaching out, even digitally, through Zoom, through telephone, through email, through Facebook, through other means, staying connected and in touch with people is important for our own health and well-being. And then of course we can reach out to professional resources, whether they are online or through telehealth type services. So we need to look after our own health. Then we need to think about the health and well-being of our teams, whether those are a remote workforce now or those still working on site. And then there are our families, our neighbours, and those in our communities, especially those who might be vulnerable all alone. In Atlantic Canada, 1 in 5 households is a single person household. And among the population aged 15 years and older, 40% are single. That's over 800,000 individuals. So people who are alone, people who don't have a support network within their own home, are at much greater risk, and we need to be aware of those who are more vulnerable. So looking after our own health, taking care of others, and then there's still a policy dimension. As I mentioned, we do need to pay attention to this issue because this affects such a broad, and all of our population is going to be affected to some degree or another. And the mental and emotional toll that this pandemic and the economic consequences will take on our health will have broad implications not only for our healthcare system, but also for our economy during this pandemic and the Great Shutdown, and as we look to a recovery from it. So paying attention to this is important. Helping individuals, supporting them and helping them find the resources that they need. And thirdly, helping organizations that have the resources and the expertise to help individuals maintain their physical, mental, emotional, and relational health is critically important. So as we continue through this Great Shutdown and this battle against this COVID-19 pandemic, let us not forget the broader health situation that it's creating, because that will have an increasing important impact if we don't take time now to address it. I encourage you to stay up to date with our research by visiting our COVID-19 web pages, signing up for email updates, and following us on social media. Thank you for listening.